Medicines play a vital role in our lives, helping us manage various health problems that may arise. They empower us to live fuller, more active lives, allowing us to enjoy our favorite activities and maintain our independence. This is especially true as we age, when the need for medical support often increases. As we get older, it's common to take more medicines to manage a range of conditions, such as high blood pressure, which requires careful monitoring and medication, arthritis, causing discomfort and requiring pain management, or diabetes, a condition that demands strict control of blood sugar levels. But with an increased number of medicines comes the critical need for extra caution and vigilance. Medication safety is fundamentally about making sure your medicines are working to help you, and not inadvertently causing harm. Our primary goal is to avoid unwanted side effects and prevent any dangerous mix-ups that could compromise your health. It's important to remember that our bodies undergo changes as we age. Organs like the kidneys and liver may not process drugs as efficiently as they once did, which means medicine can remain in your system for a longer duration. This prolonged presence can potentially lead to stronger effects than intended, or the emergence of unexpected and unpleasant side effects. A clear understanding of these age-related changes empowers both you and your doctor to make well-informed decisions about your medication regimen. Think of your body as a finely tuned machine that requires even more careful adjustments and maintenance as it accumulates years. Paying close attention to what medications you're taking, how much you're taking, and precisely when you take your medicines is absolutely key to ensuring their safe and effective use. Even small adjustments and diligent management of your medications can make a surprisingly big difference in your overall well-being. The ultimate goal is to derive all the potential benefits from your medicines while simultaneously keeping any associated risks as low as possible. This proactive approach helps you maintain your health, vitality, and independence for a longer and more fulfilling life. In this guide, we'll cover some of the most common medication-related challenges that older adults often face. We'll also provide simple, actionable steps you can take to prevent these problems from occurring. You'll learn how to effectively organize your pills for easy management, understand medication labels and instructions clearly, and engage in open and honest conversations with your doctor about any concerns or questions you may have. Family members will also discover valuable advice on how they can best support their loved ones in managing their medications safely. Remember, managing your medicines safely is a collaborative team effort involving you, your doctor, and your family. And you, as the patient, are undoubtedly the most important and central member of that team. So let's delve into how you can take proactive charge of your medication safety and well-being. With the right knowledge, tools, you can confidently and safely use your medicines to improve your health and quality of life. Let's get started on this journey towards medication safety and empowerment. Medication safety truly matters. Let's make it a top priority in our lives. As we age, our bodies change, and so does the way we handle medications. Increased body fat, slower liver and kidney function, and less water in the body all affect how drugs work. This means older adults can be more sensitive to medications, even at standard doses. Side effects may be more likely, and even over-the-counter drugs can act differently. Managing several health conditions often means taking multiple medications. This is called polypharmacy. More medicines mean a higher risk of drug interactions and a more complicated schedule. Memory changes can make it harder to keep track of doses. These challenges are common, not a sign of weakness. Support systems like pill organizers and medication lists can help. Understanding these changes lets you and your healthcare team make safer choices. Stay alert to how your body reacts to medicines. Ask for help when you need it. With the right strategies, you can manage your medications safely. Aging changes things, but you can stay in control. For seniors, even a standard dose of medication can sometimes be too much. This is because as we age, our bodies process medications differently, if the body isn't clearing it efficiently. The liver and kidneys, which are responsible for filtering medications, may not function as well as they used to. Medication can build up in the system, leading to toxic effects, even at doses that were previously safe and well tolerated. Even when taken as prescribed, it's crucial to understand that the way your body responds to medication can change over time. Harmful drug interactions are another significant risk, especially with multiple prescriptions, a situation that is quite common among older adults managing various health conditions, over-the-counter drugs or supplements. Some interactions make drugs less effective, rendering them unable to provide the intended therapeutic benefit. Others make them dangerously strong, amplifying their effects and increasing the risk of severe side effects. Symptoms of overdose or interaction can be vague, tiredness, confusion, nausea, or new rashes. Don't ignore new symptoms after starting or changing a medication. Report them promptly to your doctor or pharmacist for evaluation. Blood thinners, heart medicines, diabetes drugs, and pain relievers are common culprits in adverse drug events and interactions. Even supplements like St. John's wort or grapefruit juice can cause serious interactions with certain medications, altering their effectiveness or increasing side effects. Always tell your doctor and pharmacist about everything you take, including vitamins and herbal remedies. Keep a complete and updated list of all medications and supplements, and share it at every appointment. This helps your healthcare team spot potential problems and ensure your medication regimen is safe and effective. Stay alert, ask questions, and never assume a new symptom is just aging. It could be a sign of a medication problem. Medication safety is about being proactive and informed. Your vigilance and proactive communication with your healthcare providers can prevent harm and ensure your well-being. Common medication mistakes include taking the wrong dose, missing doses, or mixing up pills. Poor eyesight or similar-looking pills can lead to confusion. Using household spoons for liquid medicines can cause dosing errors. Accidentally taking two medicines with the same active ingredient, like acetaminophen, can be dangerous. Always check active ingredients, even in over-the-counter products. Forgetting doses or taking them at the wrong time can reduce effectiveness or cause side effects. Some medicines need to be taken with food, others on an empty stomach. Follow instructions closely. Never use someone else's medication, even if symptoms seem similar. Medications are prescribed for individual needs. What's safe for one person may harm another. Don't share or borrow prescriptions. Careful habits prevent serious mistakes. Real stories show us, in vivid detail, how surprisingly easy it is for medication mistakes to happen, even with the best intentions. These aren't just abstract warnings, they're real-life examples. Mrs. Davis, for instance, took a common cold remedy and her regular pain medicine, both containing acetaminophen, a seemingly harmless ingredient. This overlap led to an excessive dose, causing liver trouble. She simply didn't realize she was inadvertently doubling up on the very same ingredient. Then there's Mr. Chen, who took an herbal supplement, believing it was natural and safe. He combined it with his new heart medication, and crucially, he didn't tell his doctor about the supplement. The supplement, unbeknownst to him, interfered and made his heart medicine significantly less effective, and as a direct result, his heart condition unfortunately worsened. Sarah, struggling with poor eyesight, accidentally mixed up her clearly labeled morning and night pills. She ended up taking a sleeping aid in the morning, leaving her feeling drowsy and disoriented all day long. Thankfully, her family stepped in and helped her get a pill organizer with clearly marked, large print labels. Mr. Rodriguez, on the other hand, kept using his old, lower-dose pills, thinking they were still effective. He combined these with a new prescribed medication, inadvertently taking too much of the combined dosage. As a result, he felt dizzy and lightheaded until the potentially dangerous mistake was finally caught. These stories poignantly show the critical importance of carefully checking all ingredients, openly telling your doctor about absolutely all supplements you're taking, meticulously organizing your pills, and responsibly discarding any old or expired prescriptions. Even seemingly simple errors can, unfortunately, have serious and far-reaching consequences. Always double-check everything, don't hesitate to ask questions, and keep your medication routine as clear as possible. Don't be afraid to involve family members or trusted friends if you find you need some extra help. Take the time to learn from the experiences of others, so you can actively avoid similar mishaps. Ultimately, medication safety is about cultivating awareness and fostering a strong sense of teamwork. So stay informed, stay vigilant, and above all, stay safe. A pill organizer is a simple tool that helps prevent missed or extra doses. Ask a family member to help fill it if needed, and always double-check each medication. Keep an up-to-date medication list with names, doses, and reasons for each drug, including over-the-counter and supplements. Carry a copy with you and share it with your healthcare team. Store medicines in a cool, dry place. Avoid the bathroom. Check expiration dates regularly and dispose of old medicines safely. Use one pharmacy for all prescriptions if possible. Your pharmacist can spot interactions and offer advice. Build a relationship with your pharmacist. They're a key part of your healthcare team. Organization and communication are your best defenses against medication errors. Stay organized, stay safe. Reading medication labels carefully is essential for safety. Prescription labels list your name, the medicine, strength, and instructions. Ask for large print if needed. Over-the-counter labels show active ingredients, uses, warnings, and directions. Always check for duplicate ingredients. Follow instructions about food, water, and timing. Avoid grapefruit juice unless your doctor says it's safe. It can interact with many drugs. Some pills must be swallowed whole. Ask before splitting or crushing. Watch for food interactions. Dairy can affect some antibiotics. Leafy greens can impact blood thinners. Alcohol can increase side effects with many medicines. If you're unsure about any instruction, ask your pharmacist. Understanding labels helps you get the most from your medicines and avoid harm. Your doctor and pharmacist are your best resources. Ask questions about every new medicine. Know what it's for, how to take it, how long to take it, and what side effects to watch for. Bring all your medicines to appointments for a brown bag review. This helps your provider check for outdated drugs, interactions, or unnecessary medicines. Report new symptoms promptly. Don't stop a medicine without talking to your doctor. Keep notes on any changes you notice after starting a new drug. Your pharmacist can explain instructions, suggest easy open bottles, or provide large print labels. Build a relationship with your pharmacist for quick advice. Regular reviews and open communication keep your medication routine safe. Never hesitate to ask. Your health depends on it. Family members can be vital in helping seniors manage medications. Offer support respectfully. Help organize pills or update medication lists. Attend doctor's appointments to take notes and ask questions. Check in regularly, especially if you live apart. Help prepare for appointments and review instructions together. Watch for changes in health or mood. Medications could be a factor. Remind loved ones not to share medicines and to dispose of old drugs safely. Your involvement can prevent errors and support independence.